like what some of these drugs are. They're like, it's desiccated. What? It's what?
Yeah, exactly. And I just thinking off the top of my head of Premarin. I mean, that horse's urine. So that's like, what am I taking again?
Oh, yummy. Triple J, would you?
Exactly. Yeah.
Triple J, would you have horse's urine?
No, I don't think I have that. No, that is something I cannot co-sign on, sir.
Yes, I hear. Although if it normalized your weight and your blood sugar, would you still do it? I'm making him think about it.
I'll stick with keto.
You go, boy. What you got for us today, man?
Listen, I was listening to, and I know Jimmy, you probably know my backstory and
Yep.
everything. But I was looking at some of the medications I have, and I've been doing keto now for I guess almost a month, 27 days, and my blood sugar did come under normalization like my first week of keto. So I was scared at first to take my medication because I thought that, hey, I'm already getting it lowered by eating right, so I don't want to take the medicine and then get it. I'm sorry, it become even lower. But I heard you guys say about the metformin that I still can take it. It's 1,000 milligrams. You were saying that I probably can still take that and it can go good with my keto. But I also have here Januvia and Jardiance, atorvastatin.
That's the statin.
Let's see, glypiride. Yes, sir. Telmisartan. I think I got glypiride and metoprolol.
Wow.
Those are all the medications that I have right now.
So
I had stopped taking all. Oh, I'm sorry.
Oh, you took yourself off of all of them?
I did because my blood sugar was in range. So I was like, I just stopped taking them. But if I need to go back to the metformin, I can. But I had to stop taking them after my second week on keto because my level, my blood sugar had come down dramatically.
Yeah.
Yep. So first of all, congratulations. I mean, that's awesome. I mean, I hope people are listening to this because this is what can happen when you change your lifestyle and start eating well. But yeah, I think metformin is, if you have to go back on something like that, metformin would be my first choice. But I'm glad that you got off, especially that Jardiance, like I said earlier in the conversation. I'm not sure if you've heard about that, but that's something that could really put you into some trouble. And when we're talking about starting a ketogenic lifestyle, we've got to make sure that those medications, the Jardiance, the Farxiga, Invokana, we gotta stop those. But yeah, I think the metformin, I think that's a gold standard, really. I mean, in terms of increasing insulin sensitivity, and I think that if you happen to go back on the diabetes medication, that would be the one to go back to if you have to. But just curious, can you give me some numbers as far as like how your blood sugar is doing since being off the medications and adjusting your lifestyle?
Sure. I'm going into it now. I use the Live on the Go.
Live on Go.
Yeah, I
Yep.
use it, and I go to my all logs. They've been ranging like 128, 119, 123. Like before breakfast and stuff. Like if I have, it hasn't gone over 133.
After eating? Triple J?
Now that 133 was like before lunch though. I had ate breakfast.
Okay.
But it went back down afterwards to like 119 after lunch.
Okay.
So I'm staying in the ranges. It says blue, what I'm saying, beside the numbers.
What were you before you went keto and were on all those medications? What were your blood sugars like?
Man, like in the 200s. 250.
Wow.
Sometimes, especially when I wasn't eating right, man, it'd be 300 or whatever.
Wow.
And so it was in the twos, and when I started keto, it dropped dramatically. So I was scared to take the medicine because in my mind, I was like, well, if I keep taking the medicine combined with me eating right, something bad's going to happen.
Triple J, you are so intelligent, man. You are so intelligent because, Catherine, I'm sure you see patients that obviously you're teaching them along the way, but there's a lot of patients that would just eat the diet and not even realize it could have such a powerful effect that they need to come off of medications.
Correct. So there's a great opportunity, and just as you did for yourself, Triple J, to be prescribed once you start seeing the benefits of keto, which is really lowering your insulin level by diet. Now, I want to just bring something up, Triple J, and that is that the medication regimen that you were on, a lot of that was to be protective of your blood pressure, and that's very important for your kidney function. So as a precisionist, I'd be, probably in favor of keeping you on metformin, keeping you really well hydrated, having you continue to make advances with the ketogenic diet, and being really aggressive about keeping your blood pressure in range and looking at your collective cardiovascular risk, because I suspect for you, it's awesome that your sugars went from the 200s to the 100s, but I would push you towards even more optimal range. And that comes with time. And we're also probably looking at some genetics and, lifestyle can only go so far, and we can really leverage the benefit of some of these medications, which will give you better organ protection when we speak of kidneys. And keep in mind, too, that really the data for metformin that really anchored towards the TAME trial, which is using metformin for healthy people prospectively in clinical trials now, Mears Barzilai's work. That data comes from looking at diabetics, type 2 diabetics, and appreciating that they had much lower rates of cardiovascular disease and cancer when taking metformin. So that's why we see metformin used in some of the longevity spheres, or berberine, which works in a similar pathway. Plus, exercise is really, what you're getting there is upregulating that cyclic AMP kinase pathway that metformin does.
Triple
Great
J?
point, Dr. Catherine.
Triple J, any comments?
No, I was just listening, soaking it in. So I put my metformin back over here on the side so I can know I can take it. And these others, I guess, I know you got to keep going, but these others I can ask about later in the DM.
Oh, go ahead.
Like
Yeah, go ahead and ask about.
Sure that I'm doing what's right.
Yeah, go ahead and ask about them. I'm sure Rhonda and Malika don't mind.
Okay,
Triple
so
J.
putting
Oh, Brian has something to say. What you got, Brian?
I'm sorry. I just wanted to say that first of all, Triple J. I wanted to say that keep going. Keep doing what you're doing. I mean, I think you're. Like Dr. Catherine said. It's going to take time, but you are heading in the right direction. So don't give up. You're doing the right thing. I just wanted to kind of chime in on that.
Yes, sir. Thank you. I got confused when they was all prescribed, because it was just so many they hit me at. But I know you said the Newbie is going to be a no right now with what I'm doing. Jardians, I'm sorry. So the ones I have left now, I guess, is that the metoprolol, the glypiride, the atorvastatin,
The statin,
and the
yeah.
telmisartan.
Yeah.
The statin, yeah, yes, sir. So this statin is you said is kind of bad too, right?
Well, it's basically what we were talking about earlier with the cholesterol-lowering medications, Lipitor, Crestor. They're now generic. So atorvastatin, is that Lipitor, Brian?
Yep.
So, yeah. So, what benefit are you getting from that, Catherine? Would you concur that there's really probably little to no benefit unless he has some genetic predisposition like familial hypercholesterolemia or some other reason why he would need to be on a statin?
Well, the data is that the statins are protective in secondary prevention of coronary disease, not primary prevention. So,
Okay.
Triple J, that means that if you have a coronary calcium score that shows cardiovascular disease, it's probably more protective of you to be on a statin. Likely. Now that depends. It depends on how well your blood sugar, blood pressure.
Yeah.
Assuming you're not a smoker, we wouldn't want you smoking. And then the choice of the statin is one where many people, especially from a blood sugar perspective, they do better on a water-soluble statin. So the atorvastatin or Lipitor is a fat-soluble statin. So that can sometimes have a little more side effect for people than others.
Yes.
So I think there's some opportunity to like really hone in and leverage, why statins are successful is they work as anti-inflammatories for people in very low dose in some cases. So what's that sweet spot for you? First, is it primary or secondary prevention? Because I know whenever I put somebody on metformin, the drug companies or the insurance companies send me a letter saying my patients should be on a statin also. But I risk stratify my patients based on, do they have coronary disease? Would they leverage any benefit from statin? If we're choosing a statin, we're choosing one that will be as safe as possible, causing the least adverse effects. And that actually is related a lot to your genetics when it comes to how your body metabolizes those medications.
And
Dr. Catherine, I just want to say too, real quick, that you touched on another great point about the lipophilic versus the hydrophilic statins. The atorvastatin, that crosses the blood-brain barrier, and that also can contribute to memory loss and effects in that realm. But when we're talking about the ones that don't, the rosuvastatin, which is the Crestor, that's kind of like, if somebody has to be on a statin, that's kind of like my go-to statin. Do you have any thoughts on that?
Yes, I tend to use pitavastatin or rosuvastatin. And some of my patients are, if they need to be on a statin, we are having them take it as maybe the lowest dose, even every other day, so that we can really hit the targets that their lipidologists are looking for while keeping those adverse effects in check. So it takes a little bit of, testing, retesting, and then you got to do the lifestyle stuff too. So, appreciate which diet works best for your cholesterol metabolism. And then don't forget too, really, cholesterol is usually related to hormone balance. So, your doctor should be checking your thyroid levels. Testosterone is very cardioprotective in men who are deficient. And when there's a lot of inflammation in the system, we do see that testosterone levels can be less than optimal. So there's a lot of nuance that goes into this. But Triple J, the point is you've made such outstanding progress with your metabolic health, and it really has changed the trajectory of your health outcomes. And getting to learn more about what's driving your blood pressure, what's driving your risk of heart disease, why they're giving you about, and get really dialed in.
Thank you, Catherine. Triple J, thank you so much for asking your questions. And yeah, dude, like everybody else has said, keep it up. And the main thing is you are lowering that inflammation that would put you at risk for cardiovascular or other issues related to your diabetes and the insulin resistance you're dealing with. You're doing a good job. And so thank you for your highly intelligent questions.